Good afternoon. Surprisingly, ironically, this is my church, and I don't normally get this view on Sunday, so just want to talk to you a little bit about how Cleveland EMS deals with the current bedbug situation and talk about where we play a role. Here's what I am not. I am not a doctor, and I am not an exterminator. I'm not an entomologist, and you will not see my name anywhere near the word keynote for speaker. I was just asked to come do this, and I agreed. Here's a disclaimer, a little bit of disclaimer if you want to glance over it before I get started. Okay. This goes for both Cleveland EMS and fire. We need to overreact to this issue rather than underreact. The last thing we want is to cross-contaminate our patients. And also, we don't want our employees to take bed bugs home. You know, our people deal with, infectious diseases all the time. They deal with, possibly needle sticks, violence, and now they got this dropped on their lap. And we have to do everything we can to prevent them from taking it home to their families. Overview of how we attack this thing we have today. And basically a situation arises with the bed bug. Something isn't working, something's not right. We have to look at how we arrived at this point, and what are the major concerns. And this is how the whole bed bug policy started. We develop a plan of attack through research, through study, and then we go ahead and put it out there and have it tried out, and we evaluate the effectiveness of it. From there on, if it's effective, we share the information with other departments or, within our own people so they're educated on it. We don't believe in any data encapsulation or any information hiding. It's all out there. We'll show you what we have. This is no time it's time for everybody to communicate. And I also have a background in information technology, and I think that, in this case, information is what's very important, information and communication. This was kind of went over earlier, so I'm not going to rehash it. It's about how we got to this point. Everybody remembers sleep tight and don't let the bed bugs bite. Now we're kind of, sleep like crap and the bed bugs are eating you. What we saw is in 2010, we didn't hear anything about it. All of a sudden, there was a huge jump in incidences towards the end of 2010. And our crews began to voice concerns about, are we protected? What are we supposed to do when we go into a house? And unfortunately, we didn't have the answer to that. So we did a little bit of research, and we found out that we're prepared for chemical attacks. We're prepared for diseases, but in no way are we prepared for bed bugs. Our current practices that we had at the time were not eliminating, preventing, or protecting our people. So that needed to be addressed. We had major concerns. This is back to that wheel in the beginning. Are we cross-contaminating patients? Are we contaminating our homes, their homes? Are we at risk of contaminating our EMS bases? What's the cost of all this gonna be? What's the out of service time for our units? In the city of Cleveland, we don't exactly have 10 spare ambulances sitting around. They're all in use, and if one breaks down, that thing's got to be fixed. So we have a small window of opportunity to deal with it to get that ambulance back in service. We also had to look at patient confidentiality versus crew protection. When AIDS came along, people with HIV or AIDS are protected by law. So in our dispatch system, we are not allowed to enter in there when responding to a house warning of any infectious diseases in that house. It's against the law. So crews have to, unfortunately, go in blind. That's where universal precautions and protections come in. With bed bugs, this isn't the case. We looked into it, and we are able to warn units going in that this house has a history of infestation with bed bugs. However, if it's cleared up, it is taken out of the system. So we had to look into all that and see the legal ramifications. We also had to look at, we're taking these people into the hospital where other people are already sick. So we had to come up with the policy to deal with the hospitals. You know, the big thing is with the patients. You know, somebody's having a heart attack. You know, I mean, what do you say to them? You know, I know you're having a heart attack. What you really need is a good case of bed bugs. You know, we don't want to add to their problems. So we had investigation was started. Very extensive, very thorough. We used reputable sources, the Department of Defense. I think it's Tech Module 44. Journal of American Medicine. We used Purdue, University of Kentucky. They referred to Dr. Potter earlier. He has good information. So we took all this and put it all together into a research paper. And it was bed bug control strategies for ambulance personnel. If anybody'd like a copy of that, just give me your email address and I'll send it to you. But from this research paper, we formulated a general order to go out to our crews. We had education. We had to educate our employees. Why the increase? We looked at east side versus west side. When this first started, all the east side crews were being, running into bed bug situations, and the west side wasn't. So like when they got floated across town, they had no idea what to do. So we had to educate everybody. Again, like how everybody knows here, but normal people don't know what they look like. So where are they at? How can we tell them from a flea or cockroach? Funny, there was a bug crawling across one of our headquarters, because we have all kinds of outside training come in for CPR and stuff like that. And in our headquarters, somebody said, I just saw a cockroach crawl across the floor. Or they said, I saw a bug crawl across the floor, and we all got worried. And we go, what was it? And they said, a cockroach. Just a cockroach. So we had to figure out, we were using stuff that was ineffective. Great for cockroaches, horrible for bed bugs. What do these things want? And what should we look for? Okay, first thing for prevention in our case was the bases have to be clean. Although a tad of an exaggeration, some of our bases have been known to go like this unchecked. Furniture was not, the city doesn't provide the bases with furniture on a regular basis, so people would get furniture whatever methods. Somebody would look at this and go, man, you know what, just if we take that right side of that, I think we can use that in the base. That had to stop. Policy, no outside furniture or anything to come into the base. We're having some of the captains go out and inspect the bases on a regular basis. Linens is a big problem with us. Everybody thinks they need all kinds of linens. There's linens everywhere, sleep linens, patient linens, linens on the cot, towels, everything. We had to really crack down on that. We also had to make sure the personnel were carrying a spare set of uniforms, and the CAD is our dispatch system we talked about earlier about putting the addresses in when they're known bed bug sites and then removing them. Also, there's a notification to the Department of Health when we respond to a call. The way we normally find out about bed bugs is either one crawls across the patient, somebody on scene standing outside the door, and I'm not going in there, man, they got all kinds of bugs in there. Or when they're taking care of the patient, they can look at the patient or the surroundings. So that's how we normally find out, and sometimes we don't. Sometimes, like 2 hours after the call, the hospital calls and say, hey, by the way, that last patient you took in had bed bugs all over him. So then we got to stop the clock right there and retrace that ambulance's steps. Personal protective equipment was provided for our crews, including jumpsuits, boot covers. We actually have ordered a new set of boot covers that go a little bit higher, head covers, and surprisingly, one of the hitches we found is some people are allergic to the gowns. So they took it off, and they would have rather been bitten by bed bugs. They're all rashed up, and so we had to look at Tyvek suits for those people. Protect equipment bags. They're not allowed to set their soft equipments down on carpeting, the bed, keep it on hard surfaces. When patients want to bring stuff to the hospital, we have special patient belonging bags. If we try not to have them take anything to the hospital, if they want to take something, it's got to be in this bag, sealed and taped. Avoid riders from the same house. Normally, if somebody wants to ride along the hospital, you got the patient in the back with the paramedic, and the paramedic in the front driving, and then the passenger rides in the passenger seat. Now, if this person is sleeping in the same bed, living in the same house, why on earth would you put them in the passenger side of your truck? Now you've exposed the entire truck. So they are not to take riders that live in the same address. They are notify the captain in our communication center when they have a bed bug patient, and that trips that line of notification, and also the receiving hospital that we're bringing a bed bug patient in. And some hospitals actually have taken a kind of a hazmat view of it, where they'll stop the patient, clean them off, shower them before they even come into the emergency room door, and I think that's best. If time has passed, again, steps are retraced. Where the hitch comes in with this is it all sounds good except for when you walk into a house, when the paramedics walk into a house where they don't know that the patient has bed bugs, and then they find the patient in critical condition laying on the floor, and then they find out there's bed bugs. Now it becomes a moral dilemma, and our duty is to act. So the paramedics with no protection on have to get down on the carpet and preserve life first. And that's where I really take my hats off to them. It takes a lot. When they're exposed, they bring their truck down. We have a dedicated truck that's clean, sanitized, and stocked, ready to go. When they have a bed bug patient that they witness it, they bring the bed bug truck down, leave everything as is, and do a personal inspection at the hospital, and then jump in the bed bug truck. They fill out a questionnaire that looks like this. Basically, it has all the information, so we know like what areas of the squad was contaminated, what were exposed, where the patient was any belongings brought in, the address, which I blotted out. These are actual sheets. And then if you can see like the amount, the yes, the no, the all over up there, they're pretty scared. We interview the crew if we need to about further questions, like when there's children involved and stuff like that, we may interview further. The first thing we do is remove the cotton mattress from the vehicle and inspect it, and I have pictures of that coming up. And we try to determine if it's just an exposure, whereas the patient was in the squad with bed bugs, or if it's an infestation. Exposure only. That's where basically they took a patient in, they haven't seen anything since, no bugs crawling or anything. We tend to concentrate on the location of the patient. We check the mattress for its integrity, make sure there's no holes in it, check the zipper areas, dispose of all linen in the patient care area. Again, there's a star there because our people throw linen all over the place. It's clean, but it's all over the place. Inspect equipment bags that are taken into the residence. They're soft, most of our equipment's soft fabric, so we have to inspect those. And then we cover with it's a spray called Bedlam. Now when I stand here, I'm not advertising one product or another, I'm just telling you what our policy is. It doesn't mean that tomorrow we won't go with another product or that this product is better than a different one. I'm just saying what we are using at the current time. And we spray everything, the cot mattress, frames, seats, walls, floors, equipment, bags that were taken into the house. In this first picture, you can see that there's a break in the integrity of the cot mattress. If we find this, that cot mattress is immediately disposed of. A good hiding spot on the back of the cot is the zipper. The zipper's covered. So you get in there and look to make sure there's nothing in there. It's nice and white too, which is nice. And then it's doused in spray and let sit. We used a product that was safe for mattresses. That was our first concern, safe for mattresses and safe for patients. After it sits a while, then we wipe it off and clean it. The cot's the same way. We inspect it. There's all kinds of hiding places, pouches and stuff like that. And again, we spray that. Especially concentrating on the areas of like the Velcro, pockets, hiding where screws are, where there's holes. All that, we put a straw in the end and spray it in there if we see any voids where they could possibly hide. Then the back of the squad is completely sprayed. The fortunate thing about ambulances is they're not carpeted. Most of the surfaces are hard metal, and what we found so far is that bed bugs tend not to stray in this type of environment. Now, if this was completely carpeted, it might be a different story, but they tend to stick with the patient on the cot. So obviously the concentration is on the cot and the mattress. However, the entire patient care area is treated. Second is a step up. It's where we consider it's an infestation, but not a mass infestation. This is where a bug is seen inside the squad that's off the patient. For instance, last week we had a case where they took a OB patient upstairs at Cleveland Clinic, and they came down, and when they went to get in the front of the truck, because they had taken a passenger, they saw a bed bug run across the seat and go somewhere. Okay, that's when we step up a little bit. These are all still preventative because the bug just got there. What we do in these cases, we use a high-powered shop vac and dry vacuum the entire truck, every cranny. Then we use steam. Again, same procedure, steam everything, steam every crack. And this, like Gene said earlier, the problem with this is it does take a long time because to maintain the temperature, you'll steam it, and then the temperature of the water will drop, and you have to wait till it gets back up. So this is never used by itself. Then we spray, this is spray early, the bedlam spray, all over hard surfaces and cracks and everything. And then that's got to be wiped down and dried. And then finally we use a Damascus earth powder with a duster. And then we put this coating of powder all over the place and let it sit for as many hours as we can possibly keep the truck out of service. Now, if for some reason, and I hope this doesn't happen, multiple bugs are found in the truck and we're not sure when they got there and we consider a complete infestation, that's where we pass the baton to the experts. That's where it's no longer a preventative issue. And basically, I'm not even going to speak on that. I'm just going to say that's what we do. They come in and do their stuff. We can help them with whatever information we have. We also have to track. We have to do the behind-the-scenes work of tracking where this truck was, where the patients were, making sure they're okay, they weren't exposed. All crews have stepped on that truck, trying to estimate when it was exposed. And then also it involves follow-up afterwards. The whole thing of our policies is basically risk versus rewards. This treatment is specific to our ambulance personnel because some of the heat doesn't necessarily work because we have condensed gas on our truck. We also have a number of medications that are sensitive to heat. So we had to go with more the chemical route. We tend to use a combination so that hopefully one of them will work. I can say with some pride that so far we're at 100%. We haven't had any type of exposure, cross-contamination of patients or EMS crew members or family homes or bases. I'm not cocky about it though. I know our day's coming. Something's going to fall through the cracks, and we're just trying to make sure we're prepared. But we constantly reevaluate, and that's where we're at this time. Thank you.